LBP, low back pain. So this is our today's lecture topic. By definition, we can say that low back pain is simply the pain at the lower back, but the causes of this pain, low back pain, can be multiple, and we have to make specific differential diagnosis between all of these causes by different investigatory and diagnostic steps. So LBPR, low back pain, is the pain in the lower back. So now we are going to discuss its causes. So the causes can be multiple. First of all, we can say that it may be muscular cause, muscular spasm, which can cause low back pain. The muscular spasm can be due to any back posture in which the lumbar is not supported while sitting, or can be due to prolonged standing. So with these things can cause muscular spasm at the muscles of the lower back. So this can cause pain in the at the lower back. The next one cause can be due to LBP at pregnancy or post pregnancy or postpartum. So the lower back pain at the pregnancy or post pregnancy is the most common finding in females. So this lower back pain is caused due to the overstress of the lower back muscles due to the pregnancy, and this overstress of muscle is for a long time. So this can cause lower back pain, and in pregnancy the lordotic curve can also increase, which can also be a cause of pain at the lower back during pregnancy or postpartum or post pregnancy. So the third one cause can be due to disc bulge. So the disc bulge can also be a basic cause of low back pain. The disc bulge is a condition in which the disc, which is present between the two vertebrae, protrude posteriorly and cause pain at that local side, and can also depress some nerves which are going through that area, and can also cause radiating pain due to the suppression of that specific nerve. The basic example of this is the sciatic nerve, which is mostly prone to the suppression due to the disc bulge, and can cause sciatic pain or sciatica. The fourth cause, the low back pain can be due to facet joint locking. When the facet joint locked, the patient the person also has the complaint of lower back. So the facet joints are the joints which is present between the transverse process of the vertebrae. When these joints become locked, that can cause a lower back. This facet joint lock can also be due to bad posture and can cause pain at the lower back. Disc bulge, as we discussed earlier, that the disc is mostly made of water, so dehydration can also cause disc to be reduced in size and can cause bulge. And heavy load or any trauma to the vertebra or fall can also cause disc bulge and can also be related with age. So that was all about disc bulge and facet joint locking. So other causes of the lower back pain can be due to rheumatic causes, for example ankylosing spondylitis, which is mostly present at young age. So this can be a rheumatic cause of lower back pain. And ankylosing spondylitis, there is severe pain at the lower back and spasm of the lower back muscle, and the mostly spasm at the morning time when awakening from the bed. So this can be rheumatic cause of the lower back pain, and can also present at the rheumatoid arthritis, which can also cause low back pain. One example we have discussed, that ankylosing spondylitis, and RA can also be a cause of ankylosing spondylitis. So the ankylosing spondylitis, so these are the rheumatic causes of the lower back pain. Ankylosing spondylitis is seronegative spondylorthopathy, in which the RA picture is absent, but the cause of the problem is mainly the rheumatic disorder, autoimmune disorder. And the RA is the rheumatoid arthritis, in which the rheumatic RA picture is positive. So these are the rheumatic causes of low back pain. Another cause, this pain can also be due to a systemic illness. Can be due to a systemic illness, for example low calcium level, or can also cause low back pain, or low HB level can also cause low back pain. So these can be due to the systemic illnesses. And in differential diagnosis, we can also say that UTI, urinary tract infection, can also cause lower back pain. This can cause lower back pain both in male and females, and prostatic issues like benign prostatic hyperplasia. This can also cause low back pain only in male. So these can be the issues, systemic illnesses which can cause low back pain. Another, we can also say that some other problems like any internal issue of the small intestine or large intestine can also cause low back pain. For example, any inflammatory condition which inflame the small intestine or the large intestine can cause low back pain. So in systemic causes, there can be multiple causes of low back pain. So we have to make a proper differential diagnosis of each cause, which can lead us to a good diagnosis and to a good treatment procedure. So we have to be careful, and we have to be aware all of these causes, and also we should know the differential diagnosis, that how can we make differential diagnosis, and then we have to properly treat the underlying cause of the low back pain. So these were some basic causes of low back pain. After that, we can also say that gout or pseudo gout, high uric acid level, and blood can also cause low back pain. So this can also be a cause of pain at the lower back. So as we have discussed, that we should be careful all of these causes, and we should make a good differential diagnosis between all of these causes of lower back pain. In females, we can also say that any problem with the ovary, like ovarian cyst, or any problem with the uterus can also cause the low back pain in female patients. So that can be also a cause of the low back pain in female patient. And any problem with the spinal cord can also cause low back pain. So these can be the multiple causes, and we should be very careful about all of these causes, and have to make a good differential diagnosis between all of these causes. Another causes can be spondylosis, which is the osteoarthritis of the facet joints of the vertebrae. This can also cause lower back pain and spondylolisthesis, which is the slipping of L5 over S1, and this can also cause pain at the lower back. This can be due to any trauma or fall, or any force, sudden pushing force. This will cause the spondylolisthesis. Other cause can be the hypertrophy of ligamentum flavum, which suppress the local narrow roots or narrow that are emerging from that local area. So this can also cause pain at the lower back. So these are the some basic causes of low back pain. And now if we are going to the diagnostic steps, so we have to make a diagnostic step according to the patient history, and after history we have to find out our good and appropriate diagnostic steps, and which will lead us to a good treatment plan. So I have to tell you some basic points about the differential diagnosis of the lower back pain. And then if patient has a history of pregnancy, or if a female is pregnant, or a history of labor a few days ago, or a month ago, or a few months ago, so we have to note this point and to make a diagnostic step on that base, that the female can be hyperlordotic and muscular spasm, it can be a muscular spasm due to the complication of the pregnancy. So in this case we have to do a diagnostic step as a lumbosacral X-ray radiology, and we have to make objective examination. We have to observe the curve, lordotic curve of the spine, lower back spine, and we have to also check the muscles, spasm of the muscle. So this can lead us to a good diagnosis and to a good treatment. Now, if the complaint is of disc bulge, or the patient is complaining of radiating pain, so then we have to go on MRI scan. So on that we have to look at the nerve roots and the nerves that are emerging from that local point, that is there any problem with the nerve which can cause radiating pain. So then CT scan or MRI will be a good step of diagnosis. In passive joint and disc bulge, mostly the patient also complain of pain at lumbosacral joint flexion. At flexion, mostly the pain is aggravating in patients with the disc bulge. So in passive joint locking, the patient has mostly complained of low back pain when the patient is in lumbar hyper extension or extension. So then the passive joint pain is aggravating with that movement. So this is a good point for making differential diagnosis of the lower back pain. In rheumatic causes, we have to take history of pain at other body part, and how much time the complaint is with you, and can also ask about the family history. In lab investigation, in rheumatic causes, the patient complain about the low back pain during morning time, and complain of stiffness during morning time, and then relieves in ongoing day. So this can be a good point for making diagnostic steps. So diagnostic step for the rheumatic cause we have to perform ESR test. We have to see about the inflammation, and we also have to move over the RF factor, test of RF factor, lab investigation, and we have to perform physical test, which is Schober test. We have to measure the length of the spine during flexion, lumbar spine during flexion. So we can also perform Schober test for this patient. And age can also be a good factor found in case of rheumatic low back pain. In systemic illnesses, we have to perform, if we got a point from the patient in history that lead to that can be due to due causes. These causes. So then we have to measure the calcium level, biochemistry test, CBC, urinary tract infection, urine DR, and ultrasound for prostatic issues. So if we got a point from the patient history, which can be due to low back pain due to the systemic illness, so then we have to perform these lab investigation tests. For example, if the patient complain of burning micturition, then we got a point that the patient can have a UTI. And if the patient complain, a male patient complain of intermittent episodic urination and urine of low pressure, then we can get a point prostatic issues. So this can be a point. These can be points of diagnosis when the patient has some systemic illness. Other causes, if the patient complains of pain at the small joint and overall body, then we can get an aim for the uric acid level test and blood, and we have also to observe the halitosis villus and foot, which is the inward turning of the big toe. So we can also watch any type of nodules or nodes at the small joints of foot and feet and hands, and this can be due to the these can be good points for the diagnostic procedure that we are going to perform, and good points for best diagnosis and for good treatment. And spondylosis, these are also the patient complains of low back pain. Unless this is in these conditions, we have to perform X-ray scan for the low back pain. The patient has a history of OA pain that is aggravating due to movement and relief in wrist. So then we have to go these investigatory steps or diagnostic steps where the patient can spondylosis of the placid joint and other. If the pain is radiating, so this can be also due to the hypertrophy of ligamentum peroneum, which depress nerve roots or nerve over that point. So this we have to make MRI scan for this, and can lead us to a good diagnosis. So the history of patient or subject with low back pain is the point of most important. And on the basis of that, we are going to make other objective examinations and other lab investigations or radiological findings, and that can lead us to a good treatment plan, and we can properly treat the patient with these issues by making a good differential diagnosis of these causes. And so different causes have different treatment protocol. If the patient, for example, has the cause of low back pain with the patient is the muscular spasm, then we are going to relieve that spasm, and we have to care about the lumbar support of that patient. And postpartum or post-pregnancy low back pain, we have also to relieve the muscular spasm. If the patient has a complaint, has disc bulge, then we have to prescribe NSAID, painkillers, etc., or topical gels, and we have also perform different physiotherapy exercises like McKenzie extension exercises that can reduce pressure on the disc, and also we have advised to the patient to take more water and keep itself hydrated. And in physiotherapy, traction can also reduce the pain of disc bulge. If the patient has facet joint locking, then in physiotherapy treatment we have to unlock that joint by mobilization, and in medication we have to prescribe NSAIDs or topical gels, and we have to advise the patient for postural awareness, and to advise the patient to be in good posture while standing or sitting. If the patient has the pain due to any rheumatic cause, then we have to prescribe the DMARDs or to relieve the condition and to drop the ESR level, which has increased in the rheumatic cause, the low back pain, and also can prescribe NSAIDs or painkillers, and relaxation exercises or stretching exercises, aerobic exercises we have to perform in physiotherapy treatment for the patient of rheumatic disease. In systemic illness, we have to treat the systemic cause. If the patient has UTI, we have to treat them. If the patient has low calcium or HB level, we have to treat them through different medications. And prostatic benign vascular hyperplasia, we have to treat it with the medication. If the medication it doesn't relieve with medication, we have then to move on surgical procedure. So in systemic illness, we have to treat the root cause of the low back pain. And high uric acid level, we have to prescribe gout medications like colchicine, ilopropanol, and these we can also prescribe relaxation or aerobic exercises for the gout patients. And spondylosis, we have to prescribe painkillers. Can also prescribe calcium supplementation. And stress is present, we have to prescribe flexion exercises, McKenzie flexion exercise in physical therapy, and NSAIDs or topical gels for the pain relief. So if it doesn't relieve with these non-invasive techniques, then we should move to the surgical procedures or invasive procedures to solve that issue. If there is a hypertrophy, cause can be due to hypertrophy of ligamentum flavium, so then we have to move on the surgical procedure to reduce the size of that ligament that can cause the depression of the nerve root and cause radiculopathy. So by reduction of the size of that ligament, we can solve that issue. So this was all about the low back pain, their causes, their diagnostic steps, and their treatment procedure. So that's all about today. Thank you.